have Dr. Puja Patel, GP partner in Bromley, clinical care professional lead for urgent and emergency care. Got there. It's quite a mouthful.
But... It is. Thank you for trying with that.
No, but it's a real pleasure to have you here today to talk to us about what you do and the importance of what you do as well. So why don't we start off by just telling us a little bit about yourself and your role as the clinical care professional.
Thank you, Zeenat. So thank you for having me today. Today I wanted to speak a bit about being a GP in Bromley and also as a mum as well, and how important it is for us to try and stay well over winter. I think that as things have changed over the last few years, people don't often know what they need to see their GP for, when they need to see their pharmacist, for example. And I just wanted to discuss a little bit about what my top tips are to help you stay well over the winter period.
Yeah, and that's really important, isn't it? And I think it's also an ongoing thing, especially during winter, because it's time where everyone kind of, hence you can tell by my voice, that you catch things, and there's a lot going on around at the moment. But also I think generally it's important to look after yourself. I know my mother is even cold in the summer for elderly people.
Exactly. So the winter period tends to be the time where we will catch and transmit more infections that tend to be viral but can also be bacterial. And that's because the dry air is kind of a great vector for viruses to transmit each other to other people, but also because it prevents us as kind of from fighting off these infections. Our immune systems aren't working as well, and then of course we spend more time in crowded places. We don't want to go outdoors, so it's really easy to transmit viruses to each other, and as a result we just become more unwell.
And in terms of becoming more unwell, what do you suggest that people need to be doing more of? Because it just seems that more and more people are ill and catching all these viruses more than it used to. I mean, I don't know if COVID has exaggerated, if that's the right word. Thank you. I do find those words difficult. But, you know, what is it that's actually making this a lot more?
So I think that it's important that you look after yourself throughout the year. So that means having a good healthy diet, drinking, well fluids throughout the day, exercising, and looking after your mental health, of course. In the winter period, I think it's easier to become kind of less into these sorts of patterns of doing things. So we become sluggish, we don't want to go outside and exercise. Our diet might kind of edge more on comfort foods rather than necessarily healthy foods. And you probably don't feel like you're as thirsty and you want to drink, but your body still needs you to be drinking. And so generally, if you're practicing that kind of lifestyle throughout the year, hopefully when it comes to the winter months, you've already got a good backup to thrive and not to get so unwell. But when you do get unwell, there are lots of other things that you can be doing to help bolster your immune system and kind of help you through that time as well.
Brilliant. And I mean, you talked about mental health and having a healthy diet. What does that actually entail? Because there's so much out there, especially on social media, about what a healthy diet is, what you should be eating, what you shouldn't be eating. Can you give a little bit more of an insight to that from your perspective as a GP?
So I think it depends on if you have any other medical problems, of course, and then your age group as well. I mean, generally, if you are fit and well otherwise and you don't have to worry about things like diabetes or high cholesterol, then eating regularly 3 times a day, having a moderate salt and sugar intake, and just having foods from all the food groups is considered to be a healthy diet.
Right, okay. And in terms of the mental health side of things, because that's like my passion area is mental health and well-being, for people to stay mentally healthy, what do you suggest for them?
In terms of just the basic things you can do is making sure you're not spending too much time alone, that you get fresh air. Exercise does, we all I think I've said exercise about 3 times already, but we know that it boosts the serotonin levels in your brain and it makes you feel better. You might not think you want to do it, but once you do, no one says they feel worse after doing exercise. And I think that is a really an important thing for us all to remember to do. Mindfulness, I think, has really become more popular, and it is a great way for you to kind of manage those sorts of negative thoughts you're having. Things like yoga, Pilates also give you an opportunity to meditate and have some quiet time as well. I think there's a lot to be gained from doing activities that you enjoy. So whether that's, you know, arts and crafts, walking, gardening, those sorts of things. Those are the basic things that you can do. But of course, despite doing those things, you still don't feel like you're okay, you feel like something's wrong, then you need to speak to somebody now, whether that's your you know, a family member, a friend. There's people that you can see in the community, like wellbeing cafes, just to kind of open up to. But otherwise, you need to see your GP probably. You can also self-refer for talking therapies, but if you're not sure what you need or how to go about it, then make an appointment with a healthcare professional so that you can kind of talk about what's going on. And of course, they'll be able to guide you on how severe things are and what the next steps would be for you. Okay,
that's great. With you know, this whole self-referral aspects, people reaching out, there's a lot of help out there and support. It's just, where do people go in order to find the information? Because often I come across this with my clients as well, that they're not sure where to go or how to make that first step, because GP appointments are a bit tricky to get. And we're not going to get political here or anything, but they can be difficult to get that first initial appointment. There is a waiting list often. I know there's talking therapy, which you can self-refer, but what about all the other aspects in terms of CBT, if they need that support?
No, you're completely right, Zeenat, and actually it is really important that people are able to go to the right place at the right time, because that's what enables those appointments with GPs to become, you know, freely available. Because if GPs are seeing patients or speaking to patients that they don't necessarily need to have the first contact with, then the patients that actually do can't get in there. So if we are able to educate people, signpost them to the right place for the first time, that's so helpful for everyone across the community. Websites, honestly, nowadays we are digitalising, and going online, your local practice website will have lots of information on what sorts of people you need to see, or what sorts of groups you need to kind of go to initially. Talking therapies in Bromley is the website will be on your either practice website, or I can, you know, give you the details to signpost patients to that are listening to this, and they will offer you CBT, for example, if they think you need to be referred there. And patients are actually the best people to contact them in the first place, because they want to ask you detailed information, personal information. And only you really know how to truthfully answer those questions. There's no point in a GP filling out a form with, you know, just a bit of kind of superficial information. You really want to be doing that yourself. Bromley Y is where you'd go if you're under the age of 17, 16, and if you need mental health support, and your parents can of course refer on your behalf. And actually, the One Bromley website also has information on all the mental health services and the kind of different support groups that are out there. So I would say, be aware of, you know, the area that you're living in will have up-to-date information if you go to the websites. And then otherwise, of course, if you don't know, then of course.
It's really nice to be able to speak to you about this, because a lot of times getting the information out for people, the public, the community, hear about what's available, how to access things can be quite tricky. So having this conversation with you is really enlightening, and it just kind of takes away the pressure from the, you know, where people need to go.
I agree, and actually we're really keen, I was really keen to come and speak to you about this, because it is very confusing on where you go and when you go. At what time, you know, during your illness, whether it's a mental health problem or a winter illness problem. There are so many ways to access care now, whether that's over the phone, online, walking in, and it's not very clear, either sometimes to healthcare professionals, where they should be sending their patients. We're trying to do a lot of work behind this at the moment, and there is information out there. We have put together leaflets, and there's practice websites, of course, where it kind of gives you a brief overview of who you would see depending on how severe your symptoms are, how long you've had them for. And also there's a lot of other healthcare professionals in practices these days, not just GPs. So we have pharmacists, we have paramedics, we have nurses, we have podiatrists, we have mental health practitioners. There's so many different people that you can see that will actually be able to help you and provide you with treatment in that appointment. And you don't always need a GP for that.
And that's really interesting. You brought up pharmacists, because now you're able to go to pharmacies for immediate information, or if you have certain symptoms, rather than having to go to the GP. So do you want to tell us a little bit more insight to this? Because I know, I could be wrong, but I think some pharmacies provide a deeper service than others.
That's exactly right.
But if you can enlighten us on that a bit more.
So your pharmacies that you find, on the high street, they are now able to offer you advice and also treatment on common clinical conditions. So if you've got a headache, a sore throat, cough, you can go to your pharmacy and get advice on what you need to do next. They can offer you treatments that you can buy over the counter, and they'll be able to tell you also when you need to see your GP. We have a scheme now called Pharmacy First, which you may or may not have heard about. Yeah, and that's the one you're referring to, where GPs don't need to see you. You can go to the pharmacy and they can offer you treatments such as antibiotics, if you need them, for 7 common clinical conditions, and they'll be able to explain to you exactly how you take the medication, when you take the medication, what to do if the medication doesn't work for you. And as I said before, if they feel like they can't manage that for you, they will tell you, actually, you need to see your GP for this.
Right, that's amazing. Do you know what, for a short period of time, I was actually working in a pharmacy part-time, and it was really interesting to be on the other side. Do you know, another thing I wanted to ask you was about elderly people and people with disabilities. With the winter coming up, how easy is it for them to access, what can they do to help themselves better, or if they have carers?
Okay, so I think there's two things to say to that. I think it's really important for older people to be more mindful of their health, so making sure they keep warm, having the heating on at home is really important, and layering up, but also keeping mobile, getting out, fresh air, taking their regular medications, attending their GP practice for kind of their routine health checks, etc. And I think that the other thing as well that kind of falls into part of that is making sure that they're getting vaccinated.
Yes, because it's funny, because I've come across a lot of elderly people who don't want to get vaccinated for various reasons, for fears or reactions. But I mean, what would you say to that?
I think we're seeing a lot more of that nowadays. Before, some elderly population would never miss their flu jab in September down at their GP practice, but now there's so many more vaccinations. There's so much more out there as well in terms of in the media and just generally kind of misconceptions about vaccines, that we're seeing a lot of vaccine hesitancy. And I think it's really important to remember that it's scientific evidence that shows that vaccines will protect you against these infectious diseases. And so if you want to stay, well, to the best of your ability, you need to have the vaccine. They're free of charge for a reason, because they are going to prevent you from getting unwell, or at least making sure that your symptoms are as mild as possible if you were to get unwell. And I think that people that are in touch with, or in contact, with elderly population, but also the at-risk vulnerable patients as well, they also have responsibility to remember that if they get vaccinated, they're less likely to pass on these infectious diseases to these people that are more likely to have quite serious consequences if they were to get unwell with the viral infection. So there's a lot to consider, and of course it is everyone's choice, but it is becoming more difficult at the moment. There are quite a few different vaccine programs as well, and I think that can often cause confusion.
I think probably the population is getting a bit overwhelmed.
Exactly.
And there's a lot, like you said, there's a lot of mixed messages, but fundamentally in the end, being vaccinated does really support your health and your immune system.
So we've got the flu and the COVID-19 vaccinations that's available, and that's offered annually, and it will be offered to you if you're over the age of 65, if you're from an at-risk group, so there's certain medical conditions that mean you should have it. And then there's the flu jabs, obviously, if you're pregnant as well, will be offered it. Then we've got the RSV, which is the new one this year.
Yes, I was going to ask you. My mother went and had that done.
Okay, good.
I was first time I'd heard of it, so
this is the first year that's been offered, and it's a one-off vaccine, and it's been offered to a certain age group, just so it can be rolled out fairly. It's also been offered to pregnant women, because if they are protected from RSV, if they receive the vaccination, and they're passing on that immunity to their newborn baby. And we know that RSV is a very common cause of bronchiolitis, which is a lung condition that you can get if you get unwell with the infection. That can cause quite serious symptoms.
Right, so I was going to ask you, what is RSV exactly?
So it stands for respiratory syncytial virus. And as I said, it causes in babies, it causes bronchiolitis, which can cause quite significant breathing problems. So having that protection from birth, we know it really does improve outcomes. So that's why it's been offered to the pregnant women and then the certain age groups. And if you're the non-pregnant population and you fall into the age group to get it done, your GP will contact you to have it done.
Lovely. Yes. Lots and lots of wonderful vaccinations. Wonderful, I don't know about that, but really important vaccination that people need to be having. So tell us about the elderly people in terms of the access for them.
Okay. So if an elderly person is feeling unwell, if they feel like they need to speak to their GP, they've tried pharmacists, or they just feel like their symptoms are too much, they really need to speak to their GP, then they can either call the practice and make an appointment to speak to the GP or see them. They can use the NHS app and they can go online. That obviously applies to everybody. And I understand that it's difficult for the older population to get to grips with the digitalisation. Yeah. I do appreciate that it's hard for them. I think there's some people that are doing really, really well. And there is a support out there as well. So there are groups in the wellbeing cafes, for example, that we have now across Bromley. They are providing kind of support to people to go in there and kind of have their smartphones loaded up with the apps that they need as such, and just how to use them and guide them. And actually, I really do recommend using the apps or the websites as your first kind of port of call. Unless, of course, you've got an urgent problem, you need to speak to someone straight away. But even if you have had cold and flu-like symptoms for a couple of days, you're just not sure what to do. Because when you're able to go online and fill out a form, you could put in your symptoms, how long you've had them, how severe they are, and of course your medical records are there for the doctor to see. And GPs can actually look to see, what exactly you need, tailor exactly what you need to you as a person, and offer you an appointment with the most appropriate healthcare professional within the safest period of time. Of course, when you're calling, sometimes you can't get through. Receptionists will try to take the information from you. When you eventually get through, appointments might be gone. So it often can, and it can often lead to anxiety as well for everyone, especially the elderly population. But being able to use the online services is a breakthrough. And if anybody feels like they just need a little bit more support, depending on which area in Bromley that they're in, find out about your wellbeing cafe, because they are able to offer you support in that way if you haven't got anyone else in the house or the family that can help you with the digital stuff.
Do you know, you're talking about the wellbeing cafe, I'm so glad you've mentioned that, and I think a lot of people need to be alerted and aware that there are so many of these wellbeing cafes. I go to a few myself regularly and support them. And you've got, obviously, there's the Dementia Cafe, there's Simply Connect, there's You Bromley, and then there's My Bromley as well. They do one, and I've got a friend who actually runs Connections Cafe. It's a wellbeing one, a community house which is just around the corner. With a care home lady. She runs a care home, Radfield Home Care. And it's about bringing that community together and educating them exactly how to use the app, where to access things exactly. So there's some really useful resources out there for people. It's just they need to come out, and again, it's an important thing to step out of your home, get some fresh air, isn't it?
It is, yeah. I think, and they also find that social prescribers can help you put in touch with those sorts of services. Absolutely. But it is really important that people kind of leave their homes. Of course, they're going to be mindful about getting on well and things like that. But actually, fresh air, speaking to other people, some light activities, it's all really, really good for your physical and for your mental health.
Absolutely. Do you know what? Something you said earlier on that's just kind of triggered. You were talking about, keeping your house warm is really important during winter. Around sort of that moderate temperature, around 18 degrees is kind of where you need to be at. How is it going to impact people at the moment with the financial crisis we're in at the moment? I know you're not in control of that, but there's a lot of concern and worry around this, whether you're elderly or you're a young person, or parents with children, and I know you're a mother as well yourself.
mean, as a healthcare professional, I worry about that as well. It's great, I can advise that, but how doable it is for some of our patient groups is obviously very worrying. I think that keeping your house warm as much as you can in the rooms that you're in the most, like your living room, your bedroom, if that's all you can do, that is obviously what we advise. You don't sleep with your temperature very low. Keep maybe your windows and your doors closed as well, so that you're not going to be exposed to that drop in the middle of the night in the temperature. And layering up. But I appreciate it's not easy. I mean, I wish I could give you more advice on that, but it's just not something that that I have control over, but it is definitely a worry.
But it's, you know, it's important to hear and for people to realise that there are things that you can do. It's not what everyone wants to do. Not everybody wants to be wearing layer after layer at home in their house. They want to be able to be a bit more freer. But unfortunately, we are in the situation we're in, and we have to sometimes take ownership of our health and well-being.
Exactly. Self-care is really important. I think if you want to stay well in winter or any other time of the year, if you want to be able to then look after your loved ones as well, you need to make sure that you're looking after yourself. So those few things that we've spoken about already in terms of general things that you can do for your health, you know, getting vaccinated, all that is really, really important. And then also then knowing at what point do I need help from a professional as well, and taking all these things into consideration. Hopefully you'll stay the best you can.
Yeah. Can I just say this? All these brochures you have here, where are they available? I mean, they're absolutely fantastic. They've got amazing tips in them. So how can people get hold of these?
So yes, thank you. So we've, you know, a lot of work has gone into putting these together, especially by healthcare professionals, and they're all come from One Bromley. So if you go onto the website there, you'll be able to search for them. This one in particular that you've got is for children, and actually this I've been told that it's been circulated for parents to get hold of. So if you're attending mother and baby groups, that sort of thing, if you go to schools as well, and also in the library you can find a copy of this digital as well, so you can also, you know, get it up on your phones, so that you know when your child becomes unwell, at what point do I need to go see a doctor, at what point do I need to actually access healthcare. Children get unwell so much over the winter period because they're immune systems are just still learning how to fight these infections, and actually that's not necessarily a bad thing. But when you get to the point where the children are actually quite sick from it and need support, you know, when is that? These sorts of kind of literature out there and all these kind of advice, patient information leaflets are really helpful to kind of give you that reassurance as to when you do need to get help, and when you can manage quite safely at home.
Now, do you know what? It's so informative. There's so much detail in it, and I think it's wonderful, even for, because as a parent, I'm not a parent, but I used to work in the educational sector. But I see with my sister, with her 2 kids, sometimes you can become really overwhelmed when a child becomes ill. And you just can't think straight, but also for new mothers as well, or new parents, fathers, mothers, and it just gives you that good outline and guidance to, you know, like strep, scarlet fever. I mean, it's all the things that appear quite regularly.
It does, and I think that there's a lot of information on the internet that isn't quite accurate.
Yes.
It's really easy to pick up on something that's actually going to worsen your anxiety and, you know, have you thinking the absolute worst. And so making sure that whatever you reference has come from a reputable source is really important, and that's why we put together these materials, because they're very quick to access, and we know that they're written by healthcare professionals that have exactly the same training as us and actually are putting your best interests first, and also able to kind of advise on what to do in your local area, because this will change, you know, from area to area. This is very much targeted at our Bromley patients.
No, thank you for that, because honestly that is so useful. And, you know, talking about the internet, you're absolutely right. Often parents or people go onto the internet and they just start Googling, and that's where the problems and issues arise. And then they get this other source of information, and then when they come to see, I suppose, the GP, and you might say something, and they said, oh, well, I read on the internet this and this. It must be quite tricky to manage that as well.
Yeah, of course, but it's very natural. When I want to find something out that's not to do with healthcare, for example, I'll go on the internet and I'll Google it. So it's completely understandable in this day and age why people use the internet as their first kind of point of reference. But I just think that no matter what you're looking at, whether it's healthcare or shopping, you just need to make sure you're using the most appropriate and reputable source of information.
That's
and of
key.
course, when your healthcare professional that you see, whether it's your GP, the practice nurse, tells you actually what you've looked at isn't quite accurate, or actually tries this instead, I send out information leaflets, links from the internet all the time to patients to read in their own time, because I know that they're reputable sources. So if they say to you, actually use this instead of this, I think it's just a much safer way of managing it, because otherwise you just don't know what you're reading is actually accurate or not.
Yeah, absolutely. In terms of keeping warm for winter, staying healthy, what kind of tips have you got for our listeners that they can take on board and literally start implementing now?
Okay, well, I think my top tips would be making sure that you're eating well, that you're drinking fluids throughout the day. Exercising is really important. Maintaining personal hygiene, I think washing your hands regularly and just being very mindful of people around you. And of course, get vaccinated.
Yeah, those are 3 main tips.
They are.
Okay, so they are pretty standard tips, aren't they?
Yeah.
And it's amazing how often people kind of let those things slide. And I think one important thing I've learned is the vaccination is really, really important, and just looking after your personal hygiene, especially if young children, they're going into schools, catching things, they bring it home, and it's that vicious cycle, isn't it?
Exactly.
And it just gets passed on, and then you've got the vulnerable people, and if the vulnerable people get ill and they're not vaccinated, they can pass it on to other people. So yeah,
exactly. We saw in the pandemic how quickly these things can escalate, I think, and we saw that at a much larger scale. I think over the winter months, we just need to remember those things, kind of, be aware of who's around you, what healthcare professionals you can access when you feel unwell, and if in doubt, just ask.
Yeah,
it's better to see somebody than suffer at home without getting help.
Yeah. And I'm going to add one more tip on that. Try and get yourself out and go and visit these support groups that are out there, the wellbeing cafes.
Yes, definitely.
Not only is it going to help with your loneliness if you're feeling lonely, and unfortunately Bromley does have one of the highest percentage of elderly people that are also very, very lonely, but it seems to be increasing with young people too, which is it's really sad.
Yeah, it's really sad.
But hopefully by going to these places, it will kind of
meet like-minded people.
Eliminate those kind of feelings, better people's mental health, because when you have better mental health, as you know, your physical health improves.
Yeah.
It's mind over matter.
Exactly.
Is there anything else you'd like to add before we say goodbye?
No, thank you so much for having me. I think that we've spoken a lot about a lot of different things, and if people that are listening would like more kind of targeted information, would like to have a look on the websites, then that would be the best place. Go to the One Bromley website initially, or your local practice website, to find out more information in terms of actual medical advice on the things that we've discussed today.
Fantastic. Thank you very much for being here today and enlightening us how important it is to look after your overall health and well-being, especially during the winter times. Thank you.
Thanks, Zeenat.